We heard at this ESMO Congress about the results of the CEREBEL trial, which is a phase 3 randomized trial comparing lapatinib plus capecitabine versus trastuzumab plus capecitabine in patients with metastatic breast cancer HER2 positive disease. So the primary objective of this trial was to look for the incidence of brain metastasis at any time in these two arms.
We have been thinking that breast cancer cells are forced to go into the brain, into an exile where they are protected from systemic therapy. But lapatinib is a smaller molecule and it can cross the blood-brain barrier, and therefore the idea of the study was to prevent this effect and to protect the brains of the patients from developing brain metastases.
What they found as results, there was no difference in terms of the incidence of brain metastasis at any time in both arms. The incidence was very similar, 6% and 7%. So the trial did not meet the primary endpoint. They looked into secondary endpoints, which include progression-free survival and overall survival. In terms of progression-free survival, there was a better progression-free survival for patients randomized to trastuzumab plus capecitabine compared to patients randomized to lapatinib plus capecitabine. The same was true for a trend towards a better overall survival for those patients. Interesting, if you look into patients who have prior exposure to trastuzumab, there was no major difference in terms of progression-free survival or overall survival, though there was some trends towards better outcome for trastuzumab plus capecitabine. But if you look in the particular population of non-trastuzumab pre-treated, so never exposed to trastuzumab, those patients randomized to trastuzumab plus capecitabine, they had a better outcome in terms of progression-free survival and overall survival.
So what is the reason for this inconclusive data in the primary endpoint? In this trial, patients were screened at inclusion into the study using MRI of the brain, and patients with asymptomatic brain metastases were excluded from the trial. Surprisingly, a pretty high percentage of such patients was found. It was found that 20% of metastatic breast cancer patients have indeed asymptomatic brain metastases. So the question arising from this trial is, first, should we screen for brain metastases? And if we do find asymptomatic brain metastases, what to do about it? This is a question which has not been answered so far.
For the moment, there will be no practice change with these results. So patients will continue to be treated as they were. I think it is important to treat locally the brain metastasis when you have the diagnosis.
We do have very interesting points we should explore in research. So I think this trial calls for more research in the field of brain metastases.